Good afternoon, Miller Brown. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence I chose nursing as my career.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence I choose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals, therefore I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession and changes happen daily. Nowadays technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
You can now start your OET roleplay.
Hi there, my name is Miller Brown, and I'll be your nurse today. Can you tell me a bit about what brings you here today to the emergency department?
Hi, I hurt my hand while cooking. I accidentally hit it on the countertop. Now there's a bruise that's swelling a bit. It doesn't hurt much, but I'm worried.
I see. Before we get into more details, may I know your name please?
My name is Mihiraa.
Mihiraa, for better understanding, could you please tell me in detail about your injury?
Yes, I hurt my hand while I was cooking earlier today. I was trying to grab a pan and it slipped out of my hand. I guess I hit it against the countertop pretty hard. Now there's this bruise and it's starting to swell up a bit. It's not really painful, but it's worrying me.
Mihiraa, that must have been quite a shock. Let's take a closer look at that bruise. Meanwhile, could you tell me a bit about your overall health history, including any conditions or medications that might affect bruising?
No, I haven't had any other injuries to my hand before, and I'm not on any blood thinners or medications, but I do bruise easily sometimes.
Thanks for letting me know. It's great that you're aware of your body like that. Mihiraa, from what I can see here, this looks like a typical bruise, which happens when small blood vessels under the skin break from the impact. It's very common with minor trauma like hitting your hand against a hard surface. The good news is that bruises usually heal on their own within a few days to a week. So, while it can be alarming and looks unpleasant now, Mihiraa, bruises are quite common and often not a serious health issue. This can easily be treated with some self-help remedies.
That's a relief to hear. It looks pretty bad, so I was getting worried. Could you please guide me with some remedies?
Definitely, I will guide you through Mihiraa. What we can do now is help reduce the swelling and make sure you're comfortable while it heals. One of the best things you can do is apply an ice pack. In addition to the ice, it's a good idea to elevate your hand above your heart level as much as possible. This helps reduce swelling too. You can also take over-the-counter pain relief like paracetamol if you feel any discomfort. Now let me brief you about the application of ice. You should apply the ice for 15 to 20 minutes at a time, and it's important to take breaks between each session to avoid damaging the skin. You can do this about 2 or 3 times a day to help manage the swelling.
Okay, I can do that. Should I be doing anything else? Discuss when to seek further medical help if bruising worsens, increases pain, difficulty moving hand, signs of infection, e.g., warmth, redness, pus, etc. Find out any concerns or questions.
Yes, we want to make sure you're safe. Mihiraa, I just want to make sure you're aware of when it's important to seek further medical help. While most bruises heal perfectly well on their own, there are a few signs to watch out for that might need a doctor's attention. If you notice the bruising getting worse, spreading, or if the pain suddenly increases, it's a good idea to come back in. Also, if you find it difficult to move your hand or fingers, or if the area around the bruise starts to feel warm, looks red, or you see any pus, these could be signs of an infection. Infections aren't common, but it's always better to be cautious. If any of these things happen, don't hesitate to reach out to us or come back to the hospital. Now, do you have any concerns or questions?
I'll definitely keep an eye on it, but it doesn't feel too painful right now. Should I be worried about doing things around the house, like cooking or cleaning? Find out about her activities at home/work, e.g., frequent hand use, time for rest, intensity, etc. Offer advice on resting the hand as much as possible to prevent further injury.
That's a good question, Mihiraa. It's important to give your hand some time to rest, especially in the first couple of days, so try to avoid using it too much. If you're frequently using your hands for cooking or cleaning, it might aggravate the bruise or cause more injury. If possible, take a bit of a break from those activities, or at least use your other hand when you can. I know it might be tempting to get back to your usual activities, especially cooking, but it's really important to give your hand some rest right now. Mihiraa, before we finish up, let's talk a bit about how you can take care of your hand and prevent any further injury. As for caring for your hand, keeping it clean is essential, especially if the skin is slightly damaged or sensitive. You don't want to risk any infections. Just wash the area gently and avoid putting too much pressure on it. If you're doing anything that might strain your hand, like cooking or cleaning, consider using protective gear. Padded gloves or grips can really help reduce the strain on your hand and keep it safe while it heals. Going forward, when you're back in the kitchen, try to be extra mindful of sharp or heavy objects. Using padded grips on utensils or ensuring you have a firm, stable hold on pans and pots can prevent accidents like this from happening again. Slips and bumps are common, but a little extra care can go a long way in protecting your hands. Does that all make sense?
That makes sense. I'll be more careful from now on. Thanks for all the advice. I feel a lot better knowing it's nothing serious.
You're very welcome, Mihiraa. I'm glad I could put your mind at ease. Just remember to take it easy for a few days, and don't hesitate to come back if anything changes with your hand. Take care.